Hi, I'm Dr. Reese, and today we're going to talk about trauma. Now, many of us have heard that word. We may have even experienced some trauma, but what does that exactly mean? What is trauma? Trauma happens when we are faced with an event in our life that removes our feelings of safety and security. When we don't feel safe and we don't feel secure, well, a lot of times that's because we've experienced something traumatic. Before the traumatic experience, we felt safe and secure. We felt like everything was okay. We felt like we had some control over our environment. But after this traumatic event, well, now we're not so sure that we're safe. And there's not a lot that we feel secure in. When our feelings of safety and security have been removed, have been pushed to the side, when we can't find them, it's important to recognize that healing that trauma is most often going to involve restoring feelings of safety and security. Now, depending on the type of trauma, that will tell us what types of safety and security need to be restored. For instance, if trauma happened within a relationship, perhaps between a parent and a child, then that child's feelings of safety and security with their parent or with an adult figure have been removed. This is going to result in some feelings for that child. They're going to have pretty big feelings of scared, big feelings of sad. And when they don't take care of their scared and sad feelings, what results are really big, mad feelings. Remember, anger is a secondary emotion, not a primary emotion. It's not what comes first. What comes first is the really big sad and really big scared. And when they have a hard time managing that and those feelings aren't taken care of, then they grow into the really big mad. So when a child has experienced trauma, a lot of times what we will see are the three typical fear responses: fight, flight, and freeze. Now, it's important to recognize this because when we say that a child has experienced trauma, a lot of times we're looking for a scared child. We're not looking for a child who's in fight mode. And we're not looking for a child who is running away. We're looking for the child who's in freeze mode, where maybe their head is down or they are not engaging with us. However, fight and flight are also typical responses. When we don't feel safe, then we automatically, as a survival skill, move into protection mode. We have to protect ourselves. This involves something called the alert system. The alert system in the brain lets us know that we're not safe. And when something happens that initiates that alert system, then cortisol is released into our brain and adrenaline is released into our body. These make possible the fight, flight, and freeze responses. So when we have a child who is in fight mode, this can look like verbal or physical aggression. It can look like opposition and pushback to say, I'm not going to follow directions. Now, this is something that is really important for us as adults to recognize because it happens this way for all of us. When we don't feel safe, we're not going to follow directions. For instance, let's say I, as an adult, am driving down the road and my car breaks down. Now, I have called roadside service. They are on their way to help me. And another car pulls up behind me, somebody that I don't know, somebody that I don't feel safe with. And they get out of their car. And they say to me, Get in my car. I will take you to the nearest service station. What am I going to say? I don't feel safe with this person. And my survival skills and defense mechanisms are starting to engage. I am most likely going to say, no, thank you. I have roadside assistance on the way and they will help me. Now, when a child says no to us as an adult, we often label that as opposition, pushback. But we have to ask the question, why is this child saying no to us? Is it possible that this child doesn't feel safe with adults or has had experiences where adults have not been safe people? Because if we have a child who has experienced trauma in their relationship with an adult, then what is going to result is a child who is in fight mode when they experience adults. When a child says no to us, what is our typical response? It is to get a little louder and a little firmer. I said, put your shoes on. We are leaving for the grocery store, right? So let's go back to the side of the road. If I've said no to this person and they get a little louder and a little firmer with me, what is my reaction going to be? Am I going to feel safer with them? If they say to me, I said, get in my car. I will take you to the nearest service station. I am just trying to help you. Don't you understand that? Again, I'm not feeling safer at that point, and I am most certainly not going to follow those directions, right? Because my survival skills and my defense mechanisms, which were initiated when they first pulled over, are now fully engaged. I am now in complete fight, flight, and freeze mode to protect my life, to keep myself safe, because I don't feel safe right now. So let's go back to our child when they've said no to us. If we are recognizing that there may be some trauma, and not every child has experienced trauma, but if they have, we can be pretty sure we're going to see some opposition and some pushback because they no longer feel safe with adults. So when that happens, if I can recognize that this is most likely not a mad child, this is most likely a scared child. If I can reframe their face and instead of seeing that mad child, see a scared child, it will change my every interaction with that child. So instead of getting louder and firmer, what do we do with a scared child? Most often we do the opposite. We get softer, we soften our tone, and we lower our volume. So we might say, oh, buddy, I can see you're having a hard time with that. Can I help you? Again, nothing has changed for the child. They are still presenting as scared with opposition. What has changed is me. I changed. I am handling that child differently because I'm seeing him differently because of the frame that I've put around his face. So it's important to recognize that when a child has experienced trauma, this is what we can expect. We should expect opposition and pushback. We should expect children who are in flight mode, who may be running away from us, physically or emotionally or mentally, children who don't want to engage with us, children who may leave the room while we're talking, who may walk out of the house, who may go inside of themselves when we're talking and kind of glaze over. These are all ways to escape an environment that doesn't feel safe. And a lot of times for our kiddos, that freeze mode happens when they know that they cannot leave the environment that is scary to them. So they freeze. They stop responding. They, again, go inside of themselves and have a hard time engaging with us. These are all self-preservation skills. These are survival skills and defense mechanisms that are hardwired into the brain, and we just have to recognize that. Now, there are lots of different traumas that a child may have experienced. We were just talking about when an adult has not been a safe person for children. So things like abuse can have a huge impact on a child's ability to trust not only their primary caregiver, or the person who is being abusive, but also all adults. Because for children, they experience trauma in a very different way than adults do. Children have no context. Now, context is something that we all have. As adults, we have a lot of context because context is based in experiences. So I have a lot of experiences that define my context, my worldview, the way that I see things, my belief system. For children who are just born, they have no context because they have no experiences. So everything that happens in the life of a child is foundational to their belief system and their context. If their first experiences with adults, with primary caregivers, has been that they are not safe people, then that's all that this child knows about adults. That's all that they know about how to interact with an adult and what to expect from an adult. That abuse in early childhood has formed their belief system and their worldview about who adults are and what happens when they're with adults. If you're working with this child later on, it's just important to recognize that you're not just trying to change their thoughts and their feelings. You're trying to actually change their belief system, which was built based in experiences. So it's not exaggerations or stories. Their real life experience has been that adults are not safe people. So it's going to be a challenge to help them to see things a different way. Now, even though it's a challenge, we must continue to work to change the way that they see adults, because otherwise this is going to be a child who has a very difficult time connecting with others in relationship, trusting and feeling safe in connection, and being successful interacting with authority figures in adulthood. So it's really important for us to work with this child to change the way that they're thinking about adults. The other thing that trauma can do is, again, creates really big feelings in our children. Sad, scared, and mad. When that happens, we have to teach our children emotion regulation. We have to teach them how to manage those feelings that feel really out of control. And I do that in 3 steps. First of all, we want to teach our kids what their emotions are. They have a lot of emotions. If you ask most kids what emotions they have, they'll come up with mad and happy. And we want them to know that there's so many more than that. So we want to teach them what all their emotions are. We also want to teach them how to express them appropriately. So it's okay to be mad. We all get mad sometimes, but it's not okay to be bad when we're feeling mad. So we have to make good choices in the way that we express our mad and how we cope and calm it. So I teach them what their emotions are. I teach them how to express those emotions in ways that don't get them into trouble. And then we are going to teach them how to cope and calm those emotions, how to take those really big emotions and shrink them down a little bit. We're not getting rid of those emotions. Those emotions are still there. But we want to give the child control over the emotions so that the emotions are not in control of the child. Now, it's important to recognize that a normal result from trauma is the need to have control. So when other people have been in control and bad things have happened to us, then we have a tendency to say, I now need to be in control of myself. I need to be in control of my environment, and I need to be in control of everybody who comes into my environment because this is how I'm going to keep myself safe. So if we can recognize that a child is having some control issues, then we can help them to find the appropriate use of control. I have another video all about control that you can find on this YouTube station. But just remember that control is very closely related to anxiety, and anxiety is very closely related to trauma. So again, when we're thinking about different types of trauma that a child or an adult may have experienced, for children, abuse, another trauma is neglect. So there are 2 types of neglect. There is intentional neglect and there's unintentional neglect. So sometimes we have parents who are intentionally neglecting their child. Perhaps they are struggling with a substance abuse issue or a very serious mental health issue, and they are not taking care of their child. Perhaps they are just making some poor choices when it comes to parenting. And in those situations, that's intentional neglect. But there's also unintentional neglect, which happens in our areas of poverty where we have parents who are working very hard, 2-3 jobs to pay the bills and still can't get food onto the table. That's unintentional neglect. It's not that they're making a choice or unable to intellectually care for their child. They are doing everything that they possibly can to care for their child, but they're not physically able to. Now, whether it's intentional neglect or unintentional neglect, it doesn't matter when it comes to the child, because both of these forms of neglect have the exact same impact, and that is that the child no longer trusts adults to take care of them. The child no longer rests in the care of adults. This is a child who is going to rise up in independence before it's developmentally appropriate for them to do so, who's going to say, I need to take care of myself because I cannot trust adults to take care of me. When that happens, then you're going to have a child who has a much harder time having relationships with adults. This will be a child in a school setting who will say, or a home setting, who will say, no, I'll do it by myself. No, I don't want your help. No, I know more than you do. So these children become hypervigilant and do not want adults to help them because they've been taking care of themselves and meeting their own needs perhaps for years. Another type of trauma that can happen in our lives is medical trauma. So anytime that we don't feel safe, when our feelings of safety and security are removed when it comes to medical things, a diagnosis, a condition, a disorder. Think about asthma. How many of us do we know that have asthma, or a child that has asthma? Asthma is scary for a lot of children, especially if they've experienced an asthma attack where they could not get their breath. That feels very life and death, because it is. There are people who have died of asthma attacks. It is a life and death situation when that child cannot get a breath in. So when that's happening, sometimes using that inhaler will help and bring some relief. Sometimes it will not, and I have to get into the back of an ambulance and go to the hospital to get a breathing treatment. When that happens, that can feel traumatic, scary, like I'm not in control, like I can't keep myself safe. My feelings of safety and security have been removed, and this is medical trauma. Also, our babies who have experienced medical trauma even at birth, babies who have been in a NICU environment can experience medical trauma. In those situations, we have a baby whose feelings of safety and security have been removed. Now, some may be asking, how would this baby remember that? I'm so glad that you asked. So what we're talking about right now is pre-verbal trauma. And pre-verbal trauma is recorded through the 5 senses. Now, our 5 senses are active at birth, some of them before birth. And those 5 senses are constantly collecting information about our environment, presenting it to our brain for categorization, and our brain creates a groove or a neural pathway in which to store that information. When we have a child who's been in a NICU environment at a day or 2 of age, a couple of hours of age, then we have 5 senses that are actively collecting information about the smell of the NICU, the sound of beeping machines, the feel of pain, connecting all of these things and recording that memory into a groove that that child will remember. Now, this is something to recognize about trauma. All trauma is recorded this way. Whether you're an adult who just had a car accident or a baby who was in the NICU, your 5 senses recorded that trauma, which means that those 5 senses are also going to trigger that trauma. You will smell something, see something, taste something, feel something that takes you back to that place of not feeling safe. Even if in this moment you are safe, you will have a feeling that you are not safe. It's important to recognize that, because then you'll understand why we're going to use sensory coping skills to calm ourselves down. So engaging those 5 senses, once they've been triggered, we need to engage them in calming if we're going to bring some relief. So things like kinetic sand, which has a really nice touch to it, or chewing some bubble gum, which engages our sense of taste, or listening to an app on our phone of the beach waves coming in, engaging our sense of hearing, or looking at a picture of a loved one, which engages our sense of sight. So using our 5 senses to calm those traumatic memories can be very effective very quickly. Now, another type of trauma that we can experience is a natural disaster. Natural disasters are things that are happening more frequently these days to all of us. Earthquakes, hurricanes, tornadoes, floods, our house burning down. These are all natural disasters. These are things that we have no control over. They happen to us, and we just have to deal with the consequences. So again, our feelings of safety and security have been taken away from us. And in order to restore those feelings, we have to find a place of safety again. Witnessing violence is also another type of trauma. And this can be something that's happening to us, or it can be something that we're watching on TV, which is vicarious trauma, where we are being traumatized by watching someone else experiencing trauma. These things can cause us to feel unsafe in given situations. If there has been a shooting at a department store, then we may not want to go to the same department store in our area because we don't any longer feel safe and secure in that environment. Witnessing violence also happens in our inner cities on a regular basis. So if we have children and adults that we're working with in an inner city environment, we just have to understand their context. Their understanding of the world around them is completely based in trauma. And so they are most likely going to be always having a hyperactive alert system that is constantly firing, because they are constantly having to keep themselves safe, which means that fight, flight, and freeze will always be engaged. These will be children and adults who are flooded with adrenaline all the time because they are having this response from their alert system that is engaging that adrenaline. Cortisol will also be found in high levels in these individuals because of the trauma response that is ongoing. The thing to recognize as well as it's really difficult to begin healing from trauma if you're still living in trauma, because we cannot restore feelings of safety when trauma is continuing to happen day after day after day after day after day. We have to be in a safe place so that our trauma can begin to heal. So establishing feelings of safety and security is really important for any of us to recover from a traumatic event. Now, how do we do that? How do we restore safety and security? Let's start with security. Security comes when we know what to expect, when we can depend on it. So schedules, routines, sticking to them, staying organized, knowing what's going to come next in our schedule or in our routine helps us to feel stable and secure because there's no surprises. A lot of times trauma has happened when things are unpredictable. So we want to bring predictability back to our routine so that we can feel secure. Having coping skills available to us at all times. For a child, that means having them available in the house and at school. For us as adults, We just want to make sure that we have coping skills that work for us in a variety of environments while we're driving in the car, while we're at work, while we're at home, so that we can take care of those emotions when they first pop up. Again, so that those really big emotions can be coped and calmed so that we are in control of the emotions. They're not in control of us. This can help us to feel stable and secure. Now, feelings of safety have to do with a lot of times who we are with. So we will feel safe when we are with people who are safe people. A lot of times that's going to look like people who are emotionally consistent, which means that even if we are getting upset because of the trauma that we've experienced in our really big emotions, these people remain cool, calm, consistent, emotionally consistent all the time, because we will need to find our emotional consistency off of their emotional consistency because we don't have it right now. Our feelings are really big. So for a parent who has a child who's experienced trauma, if the parent can be cool, calm, consistent, then the child is going to be able to find their calm off of the calm that the parent is bringing. This is really important for children to be able to heal from trauma, is to have parents who are cool, calm, collected, and in control of their own emotions. Modeling good emotional regulation, modeling that they know how to express their emotions and cope and calm their emotions. This is going to help children to feel safe with that adult. Nurture is also something that is really important for children who've experienced trauma. Having a parent who is nurturing. And what that means is that you care about the emotions of your child, that you validate those emotions, that you say, that's a real emotion. And I'm so sorry that you're feeling that way right now. And what can I do to help you with that? There's another video on this station about nurturing care versus instrumental care for parents. And I'd encourage you to watch that to learn more about nurturing. But this is something that all of our children need, but in greater amounts for the child who's experienced trauma. So it's important to recognize that there's many different types of trauma. It's important to recognize what trauma does to our body and also what it does to our emotions and how to bring healing by restoring feelings of safety and security. If you have questions or want to talk further about this, feel free to send me a message at drreese@gmail.com. Thanks.